just as it sounds, a child development and assessment clinic. So ideally, every child between 0 to 3 years should have assessments at certain points in time, and these assessments are looking at the development. So a child develops in growth, height, but also in terms of the brain development, and the brain development is seen through achievement of certain milestones like movement, socialization, language, as well as cognition or understanding or reasoning, things like that. So every child should have assessments done at these points between at least 6 months, 12 months, 24 months, and 36 months. And here we're looking for particular milestones that should have been achieved by then. And if they haven't, the child is diagnosed with a developmental delay. And the purpose of understanding whether your child is developing well is to have an intervention done early enough, because studies have shown that the earlier an intervention is done, the better the outcomes for the child, because in that early stage of childhood, the brain is able to be taught, if I could say that, new things. So if a child has a gap in a certain area, depending on how severe the disability is, most of these children can be able to pick up skills, some a little bit slower than others, some a bit faster. But every child should have an assessment that would guide, for example, how the parents should support the child, how this child should be supported once they join kindergarten, once they join schools. And these assessments range from the motor assessments, movement. They range to learning disabilities, behavior challenges, for example, autism, which is largely an issue with socialization and sensory challenges, as well as language development. So there are various things that we assess for, but by and large, there are key points in time that we must look out for. And if a child has not achieved these growth milestones by then the child has to be supported early enough to catch up. The focus areas are really growth, development, and the disabilities are many, but there is always a standard a child should have achieved. We also do assessments for maybe there are some conditions that could have happened around birth, or in the first few weeks after birth. Some conditions are genetic, so they are varied. But by and large, what we are looking at is the child developing as they should, and if they are not, where are the functional gaps and how can we support the child in those functional gaps?